finishing with the grey matter and the white matter of the cerebrum and the lateral ventricle, now we switch on to the arterial supply of the cerebrum. Like coronary arteries, cerebral arteries, they are also the end arteries. So they do not anastomose once they dip into the subpile surface and reaches their destination, that is their blood supply, the grey matter or white matter. Now brain is the essential part of the human body, and every effort has been made to make the safe and sure blood supply to the brain. For that, arteries which are supplying or which are selected for the arterial supply of the whole of the brain, not only the cerebrum, the whole of the brain, is done by the two pairs of the arteries. One is called the internal carotid artery, other is called the vertebral arteries. So internal carotid artery, they enter into the skull anteriorly in the anterior triangle, and then they go into the skull. The vertebral arteries, they enter into the skull through the foramen magnum. Before that, they pass through the foramen transversarium of the cervical vertebra to ensure the safe passage of the internal of the vertebral arteries. That's why the foramen transversarium has been made, that this vertebral artery is very safe in the foramen transversarium, and not even by the just the pressure of the neck posteriorly, they cannot occlude the vertebral artery because they are lying in the foramen transversarium. So that is the how beautifully the two set of the arteries, they are entering into the skull to supply the brain. The two vertebral arteries and the two internal carotid arteries. Plus, these arteries, they do not have got any branch outside the skull, because both the arteries, they are made for the brain. So they do not give the blood to any other branch. So as they take origin from the arc of the aorta and its subsequent branches, they only run towards the base of the skull and they supply the brain. So two arteries, and they both anastomose with each other freely, but on the outside the brain or outside the surface of the brain. Once they go inside the brain or grey and white matter of the brain, they become the end arteries. They do not anastomose. And there are two sets of the arteries. One is called the internal carotid arteries, and the vertebral arteries. So they are the foramen transversarium of the all cervical vertebra. And this is the base of the skull, the foramen magnum. This is the sphenoid bone, the tutti fossa in the body of the sphenoid bone, and this is the basi-occiput, the occipital bone. And this lobe is the flavius, this is the foramen magnum. So this is the diploe of the skull bone. So this is the hemisection of the head and neck. So here lies the carotid canal, and this carotid canal leads to the foramen lacerum on the side of the body of the sphenoid bone. So the vertebral artery, it enters into the foramen transversarium of all the cervical vertebra except C7. So this is the first part of the vertebral artery, then it enters into the foramen transversarium. In the second part, and it reaches the C1 atlas vertebra, and it lies in the suboccipital triangle. Here this artery has got horizontal third part in touch with the arc of the atlas. Then through the atlanto-occipital membrane, which bridges across the C1 vertebra and the base of the skull around the foramen magnum. So this atlanto-occipital membrane is interrupted already for the safe passage of the third part of the vertebral artery. So this third part of the vertebral artery runs horizontally on the atlas, touching the posterior arc, and it reaches near the midline, slightly later to the midline. Now it comes the fourth part, and this fourth part enters into the skull, to the foramen magnum. This is the fourth part of the vertebral artery. This is again vertical and obliquely running. And the two vertebral arteries, right and left, they enter into the foramen magnum, into the skull, after passing through the atlanto-occipital membrane. Then these two vertebral arteries, then they unite at the pontomedullary junction. So this is how the vertebral artery is entering to the foramen transversarium of all cervical vertebrae except C7. So it is a safe passage of the artery. No pressure on the neck can occlude the artery because it lies safely around by the foramen transverse, that the bony protection has been. Anteriorly, from the arc of the aorta, two subclavian arteries, they enter and divide into common carotid arteries. And these common carotid arteries at the level of the upper border of the thyroid cartilage, it bifurcates into external carotid and internal carotid. The external carotid has got 8 branches to supply outside the skull, while the internal carotid artery of right and left side, they have got no branch outside because they are only made for the brain. So they straightway runs upward, and at the base of the skull there is a carotid canal. So this internal carotid artery is made for the brain supply, has got no branch and goes into the carotid canal present near the base of the skull, and the foramen magnum and the internal carotid artery, they are very, very close. Along with this internal carotid artery, the superior continuation of the superior cervical, the middle cervical and the inferior cervical ganglion of the cervical chain. So above the superior cervical ganglion there is a sympathetic chain is there. It is also the sympathetic chain. So this sympathetic chain, it also enters into the carotid canal along with the internal carotid artery. So this sympathetic chain above the superior cervical ganglion entering into the carotid canal along with the internal carotid artery is called internal carotid nerve. Internal carotid nerve is the sympathetic chain continuation. As the carotid canal, when we see the middle cranial fossa, on the lateral surface of the body of the sphenoid bone, or in the roof, in the floor of the cavernous sinus, this internal carotid artery, as it enters the skull, it assumes a S-shaped curve. This is called the carotid siphon. Similarly, the internal carotid artery, as it enters into the skull through the carotid canal along with the internal carotid artery, breaks up into a plexus around the internal carotid artery. And this plexus is the sympathetic plexus around the internal carotid artery. And with all the branches of the internal carotid artery forming the circle of Willis, the sympathetic fibers, they run along the branches and they reach to supply the smooth muscles in the tunica media of the vessels of the brain. So this is what is the fate of the internal carotid artery and the internal carotid nerve, the sympathetic chain occurring inside this. After this, the internal carotid artery again becomes vertically upward, finally, and it lies medial to the anterior clinoid process, just lateral to the carotid canal. So it reaches medial to the anterior clinoid process, and here it divides into the terminal branches. And it gives the ophthalmic artery to the eye, gives the anterior choroidal artery. It also gives the posterior communicating artery, and it is continued as the middle cerebral artery, as well as it gives the anterior cerebral artery. So the diameter of the middle cerebral artery is the largest in the circle of Willis because it is the direct continuation of the internal carotid artery. So this is how two pair of the arteries, they are entering into the skull to supply the brain. One posterior to the vertebra, that's why it is called the vertebral artery, and another is the internal carotid artery. It enters from the front or the anterior aspect or in the anterior tract. After that they form the circle of Willis and they supply the cerebrum in different parts. So this is the route of the entry of the two vessels in the which supply the cerebrum. As we know, the brain is lying in the skull, covered by three coverings, that is the meninges, this is the dorsal or the upper surface of the cerebrum, largest part of the brain, in the frontal lobe, posteriorly, this is the occipital lobe, and then below is the temporal lobe. And here is the midbrain, the smallest part of the brain, the bones, the medulla, which is continued as spinal cord in the vertebral canal, and here is the superior colliculus, inferior colliculus of the midbrain. Then here lies the cerebellum in the posterior cranial fossa. And cerebrum and cerebellum, they are separated by the horizontal sheet of the dura mater, that is called the tentorium cerebelli, which has got anterior perforation through which the brain stem is continued and down as the spinal cord. And on the ventral surface of the midbrain bones and medulla, that is the brain stem, this vertebral artery at the pontomedullary junction meet from the right and left side to form the basilar artery, which runs on the basilar sulcus of the bone. So this is the ventral aspect. The basilar artery runs over here. Then the basilar artery gives a terminal branch, that the superior cerebellar artery, which runs and supplies the superior surface of cerebellum. And another branch is the posterior cerebral artery. And this posterior cerebral artery is made for the cerebrum. Everything is happening between the anterior surface of the brainstem and the clivius or the base occiput. And here this posterior cerebral artery will communicate with this internal carotid artery, which is continued as the middle cerebral artery. So there is a free communication between the internal carotid and the middle cerebral artery. So this is how we see the brain with the head and neck in the hemisection or the longitudinal section, that how these two arteries they approach the brain through the base of the skull. If we see that how this is formed, then we have to make the inferior surface of the cerebrum. If you see the inferior surface of cerebrum, as I already told you, you make a big kidney. And you make the suprarenal gland. Now what you have made? The inferior surface of the cerebrum. The frontal pole, the temporal pole, with the occipital pole, with various sulci and gyri. So here you can make the two cerebral hemispheres. With the inferior or ventral surface of the cerebrum or the whole of the brain. And here comes the two crus cerebri from the cerebrum, projection fibers. The medial and lateral border of the crus cerebri, and they enter into the bridge that is the pons. And I got the basilar sulcus. It is continued on the medulla and it is superior cerebellar, middle cerebellar peduncle. Pons is having the surface, the crossing fiber from right to left, resembling the head of the Barbie doll. The pons look like this, and this is the basilar sulcus. And here anteriorly, the interpeduncular fossa, the two optic nerves with the optic chiasma here. Second cranial nerve with the pituitary stalk or infundibulum with two mammillary bodies and posterior corporal substance. And here lies the first cranial nerve, the olfactory nerve in the olfactory sulcus with the anterior perforated substance in between the two. Here, right? Anterior perforated substance is the posterior perforated. And here lies the two pyramids of the ventral surface of the medulla, laterally the two olives, and later the olive is the inferior cerebellar peduncle, and here is the pyramidal decussation, and this is the continuation of the brain as the spinal cord at the lower upper border of the atlas or C1. The end of the brain or medulla and start off spinal cord at the upper border of the atlas or the C1. The middle cerebral peduncle from pons goes into the cerebellum, and later to the olive, the part of the medulla goes into the cerebellum is again the inferior cerebellar peduncle. So both of them we are going into cerebellum. So this is how we make the cerebellum. In one diagram, whole of the brain. Here we see the inferior surface of cerebellum. I am making the inferior surface of cerebellum. So two vertebral arteries as they enter into the foramen magnum and then going ventral to the medulla and the pons. So two vertebral arteries, they meet in the pontomedullary junction, right and left, to form what is called the basilar artery. And this basilar artery runs in the basilar sulcus. Then internal carotid artery ends lateral to the optic chiasma, there, and is continued into the around the temporal pole, which is the root of the lateral sulcus. And this is the middle cerebral artery, the direct continuation of the internal carotid. And here internal carotid artery, it also gives the branch that is called the anterior cerebral artery. It runs anteriorly between the two gaps on the medial surface of the frontal lobe, and it supplies the cerebrum. Plus it is also communicating with each other, that the anterior communicating artery. Here the basilar artery will give the terminal branch. One is the posterior cerebral artery, and other is the superior cerebral artery. So this posterior cerebral artery is made for the inferior surface of the cerebrum. It runs posterior up to the occipital pole, posterior cerebral artery. Superior surface of temporal and this occipital pole. And this middle cerebral artery, while it is passing to the stem of the lateral sulcus, it gives the branches to the temporal pole. This much area is under the middle cerebral artery. While this area is behind is the territory of the posterior cerebrum. Middle cerebral artery also supplies the inferior surface of this much area of the frontal lobe, lateral to the olfactory muscle. Because the anterior cerebral artery will supply the olfactory or the gyrus rectus and olfactory nerve, is under the supply of the anterior cerebral artery. This is the middle cerebral artery. This is the posterior cerebral artery, the inferior surface of the cerebrum, how it is supplied by the artery. Then this middle cerebral artery also communicates with the posterior cerebral artery. This is the posterior communicating artery. So there is a communication between the vertebral system and the internal carotid system of the artery. So through the anterior and the posterior communicating artery, the circle is so formed, is called the circle of Willis in the fossa interpeduncularis, or in the ventral surface of the midbrain, the circle of Willis is formed. So this is how we make the conception that where the circle of Willis is formed, in the fossa interpeduncularis and in the cisterna interpeduncularis. So it is here the circle of Willis is formed. Then there are three arteries supplying the cerebrum: anterior, middle and posterior. This is how they form. So posterior cerebrum is derived from the vertebral system, while the middle and the anterior vertebral cerebral artery, they are derived from the internal carotid artery, which are both common. Now there are two sets of the branches of the circle of Willis or the artery supplying cerebrum. One is called the cortical branches, and second is called the central branches. The two sets of the branches are derived from these vessels supplying the brain. Cortical branches are called the cortical, which runs on the surface of the cerebral cortex. For example, the middle cerebral artery, after starting from the stem of the lateral sulcus, then from here it is continued on the stem of the lateral sulcus, and it ends where it ends. So while it going, it gives the branches. So these branches, they run on the surface of the cerebral cortex, the grey matter. And these branches, they are called the cortical branches. And they run in the subpile surface. they pierces the pyometer, which accompanies a little bit for a distance. Then these arteries, then the end arteries, they go into the gray matter of the cerebrum. They are called the cortical branches. So they are on the cortex. And on the cortex, they may anastomose with each other. But once they go into the pyometer and runs in the subpial surface, they do not anastomose. They only anastomose on the surface, the cortical area. So this is how we do this type of the blood supply. Otherwise, the central branches. Central branches are the branches which are going deep into the gray and white matter of the brain. They are called central because they try to reach the center of the brain or deep inside. And there are two areas, one is called the posterior perforated substance, one is called the anterior perforated substance. So the tortuous branches of the anterior cerebral artery and the middle cerebral artery, which are near to them, they pierces the anterior perforated substance and they go deep inside the cerebrum to supply. Similarly, the branches of the posterior communicating artery and branches of the posterior cerebral artery, they invade or perforate into the posterior perforated substance and they reach deep into the brain or the cerebrum to supply, for example, the basal ganglia or the deeper structures. So they are called the central branches. So this is how the branches they go. Now there are three arteries for the cerebrum. One is called the anterior, middle and posterior cerebral arteries. And the different arteries they supply different areas of the cerebrum, the gray matter, and as we have already done, that they also supply the different functional areas of the cerebrum. So three arteries, they complete the arterial supply of the cerebrum. And where the anterior cerebral and the posterior cerebral, because they are end arteries. And when they are end arteries, they do not anastomose with each other. So the area which is left between the two adjacent branches, for example, of the anterior cerebral branches or the middle cerebral or middle cerebral with the posterior cerebral or so they are end arteries. So they do not anastomose. So the area between the two territories is called the watershed zone. They are called the watershed zone area. So these watershed zone areas, they are present in other parts of the brain also, but they are very much present in the cerebrum, and they have got the clinical importance that whenever there is a occlusion of any of the arteries of the anterior cerebral, middle or posterior, so this area will go out of order first of all. So that is the clinical importance of the watershed zone. Already there is a compromised blood supply is there, but whenever there are chances or it occurs, the occlusion or thrombosis of the blood vessels, so these areas and subsequently the function of those areas of the which fall under the watershed zones, they undergo total stoppage of their function. So that is the clinical importance. So how we can depict the three cerebral arteries of three diagrams showing the blood supply. So first you have to make the superior lateral surface of the cerebrum with all the sulci and gyri, because we want to know the applied also. So once again we are making the sulci and gyri, right occipital, this is the superior temporal, inferior temporal sulcus, this is the moon shaped unit, this is is the superior lateral surface of cerebrum. Then the medial surface of the cerebrum after cutting the corpus callosum. This is the corpus callosum, lamina terminalis is the rostrum, horizontal part, then genu, the bend, the body or trunk, thickest part, and posterior free is the splenium of the corpus callosum. And below there lies the thalamus, with interthalamic adhesions. This again the central sulcus is also continued here, the precentral sulcus, the postcentral sulcus, this is the cingulate sulcus, and above here is the callosal sulcus or the corpus callosum, this is the brachiocephalar sulcus, this is the calcarine sulcus from occipital pole, unite to form the collateral sulcus which runs towards the temporal pole. So these are the various sulci gyri on the medial surface. The inferior surface we have already covered with inferior surface of the frontal, temporal and the occipital pole with their different arteries. So now we'll switch on here. The anterior cerebral artery as it runs here, it gives the branches. And then this artery, the anterior cerebral, it runs on the anterior superior surface of the corpus callosum. Up to the parieto-occipital sulcus, it gives the various branches. So this much area is under the anterior cerebral artery. So anterior cerebral artery is the superior longitudinal fissure of the cerebrum, and then these branches they come a little bit on the superior lateral surface. So they are all the branches of the anterior cerebral artery. So this much area up to the parieto-occipital sulcus, this is the area supplied by the anterior cerebral artery. This is the anterior cerebral artery. While the middle cerebral artery, as it runs a direct continuation of the internal carotid artery, it runs in the stem of the lateral surface. It starts from the temporal pole medially here, and it runs on the temporal pole, and then it reaches the stem of the lateral sulcus, and here this middle cerebral artery runs in the lateral sulcus with upturned and here near the Wernicke's area. So it gives, while passing, it gives the various branches of various degrees, central gyrus, post-central gyrus, superior, middle and the inferior frontal gyrus, the Broca's area, pars triangularis, pars opercularis, pars orbitalis, all are supplied by middle cerebral. Middle cerebral supply a larger area and the most important areas of the cerebrum. So it supplies also the temporal pole also. Plus it also supplies the superior and the middle temporal gyrus. So this much area. While the lower one, the inferior temporal gyrus is mainly supplied by the posterior cerebral arteries, which are coming from the inferior. So this much area of the occipital pole and the inferior temporal gyrus, this is under the territory of the posterior cerebral artery. It runs over there and it supplies the posterior cerebral artery, supplies this much of the area. While the temporal pole is under the branches of the middle cerebral artery. So with the different colors we have shown the branches of the anterior cerebral artery, in the middle cerebral artery, and in the posterior cerebral artery. So this line is the watershed zone between the anterior cerebral and the middle cerebral, and this line shows the watershed zone between the posterior cerebral and the middle cerebral arteries. Again, this is the area where there is a watershed zone between the posterior cerebral and the anterior cerebral arteries. This is the watershed zone area between the posterior cerebral arteries and the middle cerebral arteries. So these are the watershed zones whose blood supply is already compromised. So they give the various signs and symptoms when these are involved in the clinically thrombosis or the occlusion of the any of the branches of the circle of Willis. So after supplying all the branches, this is the picture we got: the superior lateral, medial, and the inferior surface of the cerebral cortex, which is supplied by the different arteries and the different parts. So in the clinical aspect, when we discuss the clinical aspect of this or applied anatomy of the circle of Willis, or the applied or the clinical importance of this circle of Willis or the arterial supply of the cerebrum, then how we discuss it. As we know, any part of the brain can be damaged by very much common problem is the T, T and H. So first T is the trauma. Roadside accident and brain is damaged. Any part of the brain can be damaged with the H. Second is the tumor. Any space occupying lesion. Any growth inside this cranial cavity may press any part of the brain, and it can cause the signs and symptoms. Then thromboembolism. Any thrombus or the block in the flow of the arterial blood to any part of the brain lead to the cerebral ischemia, and that lead to the cut off of the function of that particular area. The H for the hemorrhage, the bleeding, the brain hemorrhage in the high blood pressure patients. So any artery can be ruptured, leading to the bleeding inside the brain, and the blood which is coming out of the vessel undergo the clotting, that is called the hematoma, and that hematoma will press the any part of the brain where the bleeding has occurred, depending upon in which area the blood vessel is ruptured. So patient will give the sign and symptom of that related blood vessel. So if we know the branches of the various arteries and which area it is supplied, we can see the or explain the clinical importance of the circle of Willis or cerebral blood supply. First is the anterior cerebral artery. If anterior cerebral artery is occluded, or if TT and H occurs to the anterior cerebral artery, so it is pressed, or a tumor is there, or it is cut off due to accidental injury or bullet injury, so what will happen? This area will go out of the organ, plus this on the superior lateral. Whatever function areas of these areas are coming, the patient comes with the signs and symptoms. So if a patient is suffering from anterior cerebral artery occlusion or damage, then we know what lies here. The first cranial nerve, the olfactory nerve lies there, and this anterior cerebral artery supplies it, so it may be cut off. And patient will come with the loss of the smell sensation, that is the anosmia. Loss of smell, the anosmia. Second problem with the anterior cerebral artery occlusion will be to supply this much area. To supply the precentral gyrus. It also supplies the postcentral gyrus in the medial surface as well as and the upper superior lateral part. So when this area will go out of order, what is the function of this area and this area? So this area includes the motor area of the muscles of the lower limb, that is the thigh, leg and the foot and perineum. Both motor and sensory areas are blocked because of the anterior cerebral artery. So when the lower limb is involved, so patient comes with the monoplegia. only the lower limb muscle paralysis with sensory loss of the opposite side, so that is the complaint of the patient. Because anterior cerebral artery is involved, only the lower limb will be problematic, the sensory as well. So this is how we do the. Then second is, if TT and H occur to the middle cerebral artery, what will be the signs and symptoms of the patient? We know the middle cerebral artery is the large artery and it supplies most of the supply to the brain. Cerebrum, isthmus area is under the middle cerebral artery, and which areas of the functions come that way. So this area we know this is the premotor cortex, and here is the controlled by the personality, reasoning, emotional, memory, intelligence. So decision making capability, all these functions will be deranged. So that is the first symptom. Patient is not oriented to time and space. No orientation to time and space. You ask the patient whether it is day or night, he won't be able to tell. Ask the patient what you have eaten in the breakfast. He don't know. He don't know how to sleep, how to stand, how to go, how to make the decisions. All these functions they are arranged because this area is having the function. Then this area here lies the frontal eye field area. The conjugate movement of the eyeballs will be lost. This area is the Broca's area. It is also under the territory of the middle cerebral artery. So it has gone on. So in the right-handed people, the left dominant hemisphere is there. So if this artery, middle cerebral artery is involved on the left side of the right hand people, so there will be loss of speech. That is the aphonia. We shall suffer from loss of speech if dominant hemisphere has been involved. That is in the right hand person, left hemisphere, or vice versa of the Broca's area if it is involved. Then a large strip of the motor functions of the head, neck, homunculus. So patient comes with the opposite contralateral hemiplegia. Contralateral hemiplegia. Because precentral gyrus is under the territory of the middle cerebral. Similarly, postcentral gyrus is also involved because it is also supplied by middle cerebral branch. So there will be sensory loss also. General sensory loss. Pain, temperature, pressure and touch will be lost. And also posterior column sensation, that is sense of vibration, 2-point discrimination, and kinesthetic proprioceptive sensations, and the fine touch, all will be lost of the homunculus. Then this area, the Wernicke's area is there, so it is involved here. Then stereognosis area is also gone. So loss of stereognosis. Then middle cerebral artery also supplies this area, the hearing area. The middle part of the superior temporal area is also involved in the posterior cerebral artery occlusion. So patient comes with the hearing loss of 1 year, hearing loss, deafness. Then the lowermost part of the postcentral gyrus, this area, this is the taste area. So in the dominant hemisphere involvement, there will be the loss of taste. So we can write a long list of the signs and symptoms of the patient if middle cerebral artery is involved, if we know the functional areas where they are lying. We can write the clinical. Then last is the posterior cerebral artery. If the posterior cerebral artery is involved in TD and H, then what is the complaint of the patient? As we know, Posterior cerebral artery mainly supply the occipital pole, is the visual cortex. So patient come with the loss of vision of one eye, that is the hemianopia. So these are the complaints when the cerebral cortex is involved in the arterial supply of the three arteries. When the same arteries, they also supply the basal ganglia, which is the part of the cerebral cortex. They also supply the internal capsule, which is also the part of the white matter of the cerebrum. So that we have already discussed with them. So that's all about the arterial supply of cerebrum with clinical importance. Thank you.